Hello friends, this video is on bodily responses to the exposure to cold and cold related injuries. Particularly our focus is going to be on hypothermia because that is often asked as a short note at first prof level, frostbite and hypothermia. So we'll divide this video into three parts actually. Bodily responses to cold, how our body responds, what are the physiological processes in the body in response to the cold exposure. Then the second would be acclimatization to the cold, how the body will adjust and cope with that cold stress. And the third part, of course, will be the major part, will be on hypothermia. Let's start with the first one. Bodily responses to the cold, the physiological responses by the body. Of course, there are two mechanisms that will be set in. One is, these mechanisms will be set into motion. One is increased heat production, and it will be in the form of shivering. Whenever there is acute exposure to cold, the immediate response is shivering thermogenesis, and that muscle contractions will generate heat in the body so that the body can cope with the cold stress. And decreased heat loss, so this heat which is being produced in the body, it will be conserved in the body. The heat loss from the body will be prevented. How? It will be in the form of cutaneous vasoconstriction. Since the cutaneous blood flow will cause heat loss from the body, therefore cutaneous vasoconstriction means blood flow to the skin will be decreased, and this blood flow will be diverted to the core, from shell to the core, the diversion of the blood flow, so that heat in the body can be conserved and core temperature can be maintained. If the body is exposed to the cold on a sustained basis or for a longer period of time, then there would be cold acclimation. It's called acclimation. It can be called as acclimatization or cold adaptation. So basically what happens as a adaptation is there is shift from shivering thermogenesis to non-shivering thermogenesis. How far will you continue to cause muscle contractions? There will be fatigue. Therefore, there will be shift. That is, now the shivering will stop, but heat will be generated by other mechanisms. That's called as non-shivering thermogenesis, and that is mainly by the increased secretion of thyroid hormones. You know, thyroid hormones, they will increase the BMR, metabolic rate will increase, and as a byproduct, heat generation in the body will also increase. There are other mechanisms, for example, brown adipose tissue. It will also generate heat, but it's minor, at least in the adults. It is more so in the case of infants and newborns. So this is by which the body is adapted to the cold exposure. And now we will see the main part of this video, and that is problems of cold exposure. That is, if the body is unable to cope with the cold stress, there is likely to be cold injury, and let's see what are the consequences. Now this cold related injury, it may be localized or it may be generalized in the form of hypothermia, where the body temperature and the core temperature will drop below 35 degrees. So localized, confined to a particular tissue, particularly peripheral parts of the body, fingers, toes, etc. And the localized injuries are in the form of frostbite, immersion foot, or chilblains. And generalized cold injury or effect of cold is in the form of hypothermia, where there is decrease in the core temperature of the body. This is going to be a serious condition. Of course, the previous ones are localized ones are also kind of serious situations, but then hypothermia can really be life threatening. Let's see the localized injuries first. Direct injury to the tissues. Now this direct injury to the tissue because of the cold exposure, it can be of one of the two types. Either it could be a freezing injury, that is, the tissue is frozen and therefore it stops functioning, it is damaged. Or it could be a non-freezing type of injury, whereby excessive vasoconstriction has caused a loss of blood supply to a particular part, and therefore the part is ischemic and damaged. So freezing injuries where tissue is directly frozen because of the cold exposure. Let's see what are these direct injuries. Chilblains. Now this happens when there is exposure to the cold and wet. This is often seen in swimmers as they are underwater for quite some time, and if it's a very cold water and the exposure goes on for quite some time, then it may result in chilblains. What happens is red or purplish colored skin lesions, and that are very tender. I mean, they are painful lesions, red or purplish in color. They are painful, but they are short-lived. So they will disappear over a period of time as the blood supply, blood flow to the skin improves. So this is relatively non-serious condition. Second type of injury is immersion foot. Immersion foot, also called as trench foot, and this is quite often seen in the soldiers, because the soldiers during the battles, they have to stand in the trenches, and the trench might be filled with water. So if cold atmosphere and plus uh, foot immersed in the water, therefore resulting in this condition. This is a non-freezing type of cold injury. So it's not a direct impact of frozen tissue. Prolonged exposure to the cold and damp conditions. So foot is cold, ischemic. Because of the cold exposure, there is vasoconstriction. As you are aware, cold will lead to vasoconstriction, and therefore there will be ischemia, sustained vasoconstriction, loss of blood flow, and therefore there will be numbness in the foot or in the toes, but no freezing as such, as we already said. What is the probable mechanism? The mechanism that is probably underlying this condition is that there is possibly an endothelial injury and dysfunction. So endothelial injury occurs, or probably dysfunction results in loss of blood supply and therefore resulting in immersion foot. Treatment, of course, is rewarming. The body part which shows this kind of lesion, it should be rewarmed. Let's say it's a foot, so it should be rewarming. But just remember, the rewarming should be gradual. It should not be very rapid. If the blood flow suddenly increases, it might just increase the pain in that body part. So it should be a gradual rewarming. And the third type of injury on which a short note can be asked at the first prof level is the frostbite. I have made another reel on this. I tell you, I saw first year students journal and they wrote, without applying their minds, they wrote frog bite. Anyways, frostbite, frost, what is the meaning of frost. So frostbite, this is a freezing injury. So far, the first two were non-freezing type of injuries. This is going to be the impact of direct freezing of the tissue because of the exposure to cold. This is seen in mountaineers. Mountaineers are exposed to cold atmosphere and for prolonged periods, and this results in the direct freezing of the body tissues. Mostly it occurs in the extremities. So it will be the digits of the hands and feet, fingers or toes, ear lobes, face. These might be the affected parts. The tissue may become anesthetized. Now this part needs to be understood. Initially, because of that excessive cold exposure, the tissue may become anesthetized, and because of this happens before the freezing injury occurs. So therefore, initially the person may be unaware of the injury that is happening. See, pain is a way of telling the body that some injury, some damage is going on. Initially, the body part is anesthetized in this condition. So therefore, the person may not notice the injury that is happening. It may go unnoticed. Tissue is initially pale, loss of blood supply, and therefore the tissue will appear pale, and later on it will become frozen and hard. So that's how it occurs in stages. Prolonged exposure will lead to cell death in that area. So necrosis followed by gangrene, and in this condition, if there is gangrene, then well, amputation of the digit, amputation of the toe might be required. So this is the condition of frostbite. How do you treat? As soon as you get to know about this condition, about the patient, then thawing the body part, thawing or rewarming, let's say rewarming, and of course it should be gradual. The patient may be hospitalized, there should be a gradual rewarming, and observation should be done in the hospital stay. And of course, wound debridement. If there is gangrenous area, then the wound cleaning and debridement will be necessary. So that's about the frostbite. What you need to know is what is the reason for frostbite, then how does it appear, where does it appear, and what is the, how do you manage it. So if there is a short note at first year level, you can write this. And now let's come to the serious clinical of course the previous ones were also serious conditions, but serious in the sense that the previous conditions were localized, whereas this is a serious condition which is generalized. It involves entire body. Now hypothermia, this is when core temperature falls below 35 degrees. You know the normal temperature is 37 degrees. If it falls below 35 degrees, it results in hypothermia, and this happens when there is failure of thermoregulatory mechanisms. We have already discussed the thermoregulatory mechanisms and how the body can respond and adapt to the cold environment. But if those mechanisms fail, then it might result in hypothermia. Here I am talking about a healthy individual having normal thermoregulatory mechanism, and that mechanism fails, and that results in hypothermia. There are other sets of populations in which there may be already problems with the thermoregulatory mechanisms, and that resulting in hypothermia. For example, infants. You know, infants, they when they are born, newborn baby, it is coming from a warm and moist environment of the uterus to a cold and dry atmosphere of the outer world, and therefore infant is likely to suffer from hypothermia, particularly because infants and newborns, they have high body surface area to weight ratio, and therefore they are likely to lose heat from the body very instantly, and therefore might be a chance of hypothermia. Or elderly individuals in which the thermoregulatory mechanisms are already compromised. Hypothyroid individuals, you know, they are intolerant to cold. Why? They cannot, when they face the cold, they cannot increase their BMR. Heat production cannot occur normally in a normal way in their bodies. Or drugs, certain drugs, for example phenothiazines, they are known to interfere with the thermoregulatory mechanisms. So keeping this population aside, we will focus on the otherwise normal and healthy individual exposed to cold, having normal thermoregulatory mechanism, but that mechanism fails, and that resulting in hypothermia. So intact thermoregulation, but inability to cope with the cold stress, and particularly failure of the cutaneous vasoconstriction. Now this can occur in three ways: acute, subacute, and subchronic. Acute means in the cold water. If a body part is immersed and kept in the cold water for quite some time, or entire body, for example, we saw in the case of swimmers. Subacute in the conditions of hill climbing, because it's going to be a gradual fall in temperature and their sustained exposure to cold. And subchronic means old, frail, debilitated individuals, or rather not debilitated but old and immobilized persons. In them, although thermoregulatory mechanisms may be intact, but they may still suffer from hypothermia. Why this classification was necessary? Because the rewarming treatment will depend on whether it was acute, subacute or subchronic. Now, it could be a mild hypothermia or a severe hypothermia. Mild hypothermia, there will be cold and there will be shivering. Whereas severe hypothermia means cold but non-shivering. The mechanisms are failing. So shivering mechanism induced by the hypothalamus will also fail. So a patient will be cold but non-shivering. So mild hypothermia, cold and the patient is shivering. Thermogenesis happening. There may be dehydration, confusion and ataxia. You might have experienced this when if you are ever exposed to the cold environment. There is some amount of ataxia that also is there, tremulousness and inability to coordinate between muscle groups. That's the ataxia. Right, in the severe hypothermia, there is going to be muscle stiffness. In addition to the confusion, ataxia, there will be muscle stiffness, almost muscle rigor, and decreased consciousness, hypotension, bradycardia. So it's a kind of sympathetic failure. Therefore, no vasoconstriction possible in the cutaneous circulation, plus hypotension, bradycardia. Remember, it's an important point. For each 1 degree fall in the core temperature, we are looking at a fall of core temperature, mind you. For each 1 degree fall of core temperature, arterial PO2 falls by about 7%. This is a physio plus plus, as I like to call it, a very important point. If you highlight it right in the exam, it will fetch extra marks. All right. Now, another important point, if you highlight it in the exam, again extra marks. ECG findings. There is possibility of arrhythmias, ventricular fibrillation, and there is one typical finding of hypothermia, which is J wave, Osborn's J wave. It is at the junction of QRS complex and ST segment, and it's a form of it's somewhat like a hump which appears at the junction of QRS complex and ST segment. So this hump, called as J wave, is a classic finding in the hypothermia found on the ECG. And one more important aspect, and this is very interesting but at the same time very important clinically speaking. Diagnosis of death is a very difficult and tricky situation in the conditions of hypothermia. The patient who is exposed to cold and hypothermia, severe hypothermia, core temperature has gone below 35 degrees. Now, how do you establish whether the patient's death has occurred or it's only hypothermia? Reasons are these. A hypothermia, patient having hypothermia will be in the comatose condition, coma, unconsciousness and rigid muscles. May appear dead. Pupillary reflexes very often are absent. As the nerves are not functioning normally, the reflexes are also absent, particularly pupillary reflexes are absent. These reflexes are checked generally to confirm the death. Now, these reflexes are absent in hypothermic individual. And most importantly, there is cardiac asystole. Heart is not into systole, heart has stopped, it's almost cardiac arrest. You don't feel the carotid pulse for about a minute. And these are the findings in a severe hypothermic individuals. So, establishing whether the person is alive and it's hypothermia or cold exposure has resulted in death, this becomes a very tricky situation for the clinicians. Finally, the management. If you are at the first prof level, don't worry much about the management. There will be rewarming, treatment of hypoxia, treatment of acidosis. We already saw hypoxic condition is, the person is hypoxic. So treat hypoxia, rewarming of the patient, fluid and electrolyte balance should be corrected, and arrhythmias should be treated. So all those things which are seen in the hypothermia, they should be treated on an urgent basis. So that was the condition of hypothermia, and these are all the conditions related to the cold injury. Particularly hypothermia or frostbite are asked as short notes at the first prof level.